It's so obvious to me that we're over medicating the absolute shit out of our kids. And to be honest, if somebody tells me that I should medicate my 5 year old because they're hyperactive, it's going to be hard to hold my tongue. I
Yeah.
mean, it's just a ridiculous phenomenon. And one of the things that bothers me to the core is that we don't ever hear about how other countries are dealing with the same problem. Did you have the opportunity to look into how other countries view, evaluate, and treat ADHD?
Not as much as I probably should have, but I have a big base of followers in Australia, England, Canada, and the US, the obvious ones, the English speaking ones. The other sort of like I'm Swiss, so I've heard about the Swiss and German kind of rates. A few things I heard about, one was India, which was this philosophy that the wise men say, oh, those diagnosed with ADHD, those are actually like the wise ones, right? The advanced ones. And then I've just always been fascinated how, like, what's the ADHD rate like in, say, Afghanistan or Iraq, right? No one talks about it. You can find it online, I'm sure, but when you talk to people from those countries or you mention it, they go like, what is it? And you're like, well, it's this thing and it's called this. Like what? Oh, well, attention. Uh, yeah, some kids, I guess, but it's not like this thing. In the US, it's almost like, gee, I hate to say it, but if you think about it, in the US, it's almost like one of the top talking points if you talk about mental health, right? I mean, there's depression and then you have autism, obviously.
Everybody's okay with having ADHD,
Yeah,
but not depression, or
right.
sometimes not even anxiety, or certainly not schizophrenia or psychosis or bipolarity.
Yeah.
Everybody is like, oh, yeah, ADHD, that one's okay. That one's not as stigmatized. Let me show you something real quick because I love this graph from
Afghanistan.
2015 to 2019. So this breaks down, year over year, every continent and what the rates are within that country. The United States in general is the red is amphetamines and the blue is methylphenidate. Both of those are stimulants.
Yeah.
But in terms of the daily dose, we dwarf the rest of the world. Yeah, you've got some other countries that their rates are a little bit behind us. Canada, it seems like it maybe has overtaken us, but specifically amphetamines, drugs like Adderall are prescribed at an insane clip in the United States. If you look at the absolute numbers, because a lot of these countries that have similar rates are not nearly as large as the US, you're talking about like 85, 90% of the world's amphetamines in the United States, which
Yeah.
is an absurd, absurd number.
And it's
Um,
interesting if you look at, and this is to my intuitive point, if you look at Jordan, Kuwait, Lebanon, Saudi Arabia, like Algeria, Egypt, there's nothing, nothing, it looks
yeah,
like
to your point, India and Pakistan just don't
nothing. Yeah.
don't treat it.
Philippines or even, and this is an interesting one. You look at China. Now, of course, it also depends on the system, right? How do they classify and
And how
diagnose?
well are they able to receive the information and get
Yeah.
the reports
Y-
about
Yeah.
rates of prescribing?
But also, again, how many people actually call it clash with the environment or the world around them such that they stand out and you have to do something with them, right? Because if you figure out a way to keep everyone busy and use everyone's strength, or obviously in the case of China or maybe some of these countries where maybe they're forced to do something and you can't speak up. So I don't want to, that's not appropriate maybe to say that's China's case. But I do believe that if you live in Kuwait and you have too much energy, then your dad, even if you're 7, you're going to carry brick and you're going to freaking build walls and you're going to be with the goats and you're going to run up and down. Like there's just not a sort of sit down and go like, oh, I'm really not happy and I'm just clashing with the environment and I need some medication. So again, is it real? Is it a thing? Is it like, but your graph is great because it clearly shows that we over medicate, we
Here, let
overdiagnose
me
and over
show you one
medicate.
more on the in the same vein there.
I'm
This is
not
the world,
seeing the world.
and when you look at the dark red, That's over, I think it's 100 milligrams defined daily dose, or it's some unit. But look at our rate compared to the rest of the world. You've got little pockets of orange that indicate a higher prescribing rate. But by 2019, I mean, it's all dark red in the United States, Canada, all across North America. And I think this philosophy of undertreating ADHD is now spreading worldwide. Again, it's not that treating ADHD with stimulants is a bad thing, but
No.
we're doing too much. Like the way that I view stimulants and drugs in general, substances have been a part of our evolution,
Yeah.
and they're not categorically bad and they're not categorically good. It's definitely unique to each individual. But in the world that we live in, for a kid who has no interest in their undergraduate biology class, but they have a pursuit of a larger goal and a larger degree, I don't mind prescribing a stimulant if you're not able to complete your work because you can't stay attentive to something you don't care about.
Yeah.
That's different than saying, hey, you need this, you're broken, and you're always going to need this.
Yeah. You know, it brings me back to this metaphor. The graph you showed was great. For example, if you break your leg, let's say the makers of casts have found out how expensive, how much they can charge for any cast that they put on someone's leg or a limb, or right. And so you put it on, your leg has healed. And now they're going to do studies and say, well, if you leave it on a little longer, actually, you can prevent breaking it again faster, right? So suddenly you have these studies. And then somebody will say, well, even if your leg's not broken, but it's strained or whatever. But so let's say suddenly you have studies that say, well, actually, if you put a cast on it when it's strained, you are also preventing further damage, right? So, so, um,
Gosh, your
essentially, right?
ADHD is so bad. We're going to have to get you something.
Oh my God. It's not enough for me to put a sign on the door that says podcast recording, but it's okay. Love you. So if we suddenly build that system and then suddenly somebody really paranoid says, oh, you know what? I'm feeling a little sore in my arm. And then they look it up and it says, you know, if you put a cast on now, you're going to prevent, right? Suddenly you have everybody that says, like, you should put a cast on, you should put a cast on. And now it becomes this system, this business, this industry. And like you said, you look at the numbers, it's like it's gotten out of hand. We don't need, in the metaphor, a cast for every little ache, you know? I know that's a, I tried to keep it in a
I was going to
medical
say
metaphor.
the only thing I don't like about that analogy or metaphor is that we don't do much of preventive medicine here in the United States.
Yeah.
It's
Yeah.
all wait till the sky has fallen and then we'll try to put it back.
Yeah, yeah, absolutely.
Um,
No, I get it. For me, it's just such a visual, right? It's like with my son, my 13-year-old just got home from school. Often he'll be like, "Dad, my ankle hurts," and I'm like, "Okay." And then we talk, and suddenly I realize, oh, he hasn't worked out or done sports with this, and he did flag football, and now it's the little tendon. You know, suddenly it's not the ankle, it's something underneath, and I use a massage gun, and he's like, "Oh, I feel so much better," right? But if somebody is hypochondriac or always worried about like, oh my God, suddenly they're at the doctor's and they're getting some brace or prescription of pain medicine, and the system it just so easily takes you in and prescribes you something, right? That's overdone for sure.
yeah, absolutely. I mean, here in Kentucky, we know all too well the dangers of overtreating pain. And that's one of the historical obvious events that I warn, I give caution. I mean, we were told throughout the 80s and the 90s in medical schools and medical school curriculums that pain is the fifth vital sign. We really need to treat pain down to zero. If you're not treating your patient's pain, you're a bad doctor. You're a bad provider. Well, that ended up in the worst addiction crisis in the history of the world,
Yeah.
not just modern history. We're talking about the worst addiction crisis that has ever existed.
Yeah.
It is crazy to me. We have 25% of the world's overdose deaths and 4.5% of the world's population. And that's just the bottom of the barrel. When you
Yeah.
talk about all the debility that comes from the addiction crisis, people who don't die, but end up with really terrible medical problems or mental health problems. That crisis is so much bigger than people realize. And if you want to say we've turned the tide, we're talking about 100-foot tide.
Yeah.
So maybe it's 99 feet now, but it's still a massive, massive major problem. And so again, I think about that. Oh, we've created this opiate that isn't addictive. Well, opiates have been addictive since the Middle Ages. We've known that they're addictive. There are not non addictive opiates. And the connection here to ADHD is somebody could come to me, they could have depression, anxiety, even often bipolarity, ADHD, or nothing. They could not fit the criteria, even though that rarely exists for anything. And if I give them Adderall, if I give them an amphetamine, they're going to come back and say, oh, that made me feel good because it
Yeah.
causes a massive release of dopamine and norepinephrine that is abnormal to the brain. And it makes us feel energized and motivated
Yeah.
and focused. But that doesn't mean you have ADHD. But what it
Right.
does is it feeds back to the individual. Oh, this is good for me.
Yeah.
This whole idea that, if you don't treat ADHD, you're much more likely to become addicted to some substance makes no common sense to me
No, it's the opposite.
because people are becoming addicted to Adderall and amphetamines
Yeah. Yeah.
because of the way that they work. It's pushing the dopamine lever. I mean, any of us, like the way that I view addiction is we all have addictions.
Yeah.
It's not a matter of if we try to escape our environment through some external habit. It's a matter of what are the consequences of that?
Yeah.
How upfront can I be with myself about my addictions and how I'm managing them?
I love that you bring up addiction because, and we may have talked about this in our pre talk, but I went to a sex addiction specialist in Utah at the time. I was researching into love and sex addiction, and I had some issues with it myself. And I was talking to his top expert, and I asked him at some point, I said, I know that ADHD is not an addiction, but doesn't it function like an addiction? And he's like, what do you mean? I said, well, an addiction's a coping mechanism. Like you're coping with something and you have something that feels good. And so now you want more of it. And I was like, well, with ADHD, you might be bored or feel unsafe in the moment. And so you need the shiny thing over there. And then you get addicted to the dopamine release of the more exciting thing, right? Than being over here. And I remember him looking at me going, huh, that's interesting. Never thought about that. And I was like, huh, that's interesting that the top addiction experts never thought about that, right? But my point is that I agree with you, especially if you medicate a child, right? You are giving them this external substance, this crutch to feel that they can now function and their whole, and here's the kicker with young kids, they're celebrated because, oh, now you're so good because you can sit still. Now we love you. Oh, okay. So then, because if I have too much energy or if I'm going to really kind of be myself and excited, they don't love me. But if I sit still and shut up, they love me. Got it. And so, as a young kid, what do you want? Love. You want, right? We want to be accepted. We don't want to be thrown out of the tribe. So we become someone different. We become the people pleaser or the sit still, goody goody, two shoes kind of boy, right? So it's dangerous, not only, like you said, there's the physical dependency, right? The biological dependency, but there's that psychological, like, I need it. It's my crutch. I need to lean on it and I feel better. So give me more. So again, for parents, like I would really think about that. Like I'm going to be modest by saying there's a 50-50 chance your child will get addicted to these drugs and will in adulthood still feel some form of insecurity that's deep that needs to be healed through therapy into the old age because of using a band-aid to put on a deeper wound for too long.
Yeah, I mean, I think pharmacologically, when you look at dependence and withdrawal cycles, you're talking about a dopamine deficiency every morning when you wake up, if you take it every day. You are going to have a dopamine and norepinephrine deficiency. You're going to feel like you can't wake up. You may have an increased appetite when it's out of your system. Basically, all the things that stimulants do, you're going to have the opposite. I mean, where's that in the discussion?
Yeah.
You're stimulating the release of all of this. What does that do to your own endogenous or your own natural production of those things. Because what happens in the brain and the body, it's an endless number of feedback loops. And the vast majority of them are what are called negative feedback loops, where when one thing becomes high, like dopamine, your brain says, I don't need to produce as much of that.
Yeah.
So
Yeah.
how is that not a factor or not even part of the conversation? And I loved what you said about talking to the top addiction expert. What I've realized in doing this podcast, Renegade Psych, best thing about it is I've gotten to talk to experts, just saying, hey, I got this podcast. Would you like to come talk to me? Perfect. I don't make any money off of this, but I get absolute wealth of knowledge by doing it. And you alluded to what I see in most experts. They're not there to ram the truth down your throat.
Yeah.
They are open ears, willing to listen, even to somebody who doesn't have a medical background in treating ADHD, because they're just curious and they care about getting closer to whatever the truth is. I'm
Yeah.
not here to say that I know the truth about ADHD. That's not the point. My point is when the truth is being rammed down your throat and you're getting all these labels because of your disagreement, that to me just screams propaganda and manipulation.
I agree with you. And you know what you made me think of earlier is when our son was, told that he should take medication, right? That was literally the first resort. They said, well, first of all, medication. They kind of were like, well, that one for sure. And then we're going to do da 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 da, right? So I said to myself, and I now am a big believer that we should implement this. Like, so if you want to give your kids, like, say, Adderall, we'll just pick one, right? Could be Ritalin or any of the other ones. You as a parent should be required to take it for 3 months yourself because I did that. I tested about four. It was Ritalin, Adderall, and then two. What was it, Vyvanse and something else? Because I wanted to see what it feels like. And of course, people are going to say, "Well, your dosage is different than my child's dosage." Yeah, but it's based on weight and like tolerance and all that, right? So I tried it, and it was horrible. I mean, were there good days? Yeah, there was some days when I'm like, I got shit done, But then I was exhausted. My brain would hurt. I couldn't sleep. Some days I had headaches. Then I was like, my wife or ex-wife, but wife at the time was like, You're just kind of a jerk today, kind of edgy." And so there were all these different, and I was like thinking to myself, oh my God, I'm so glad my son isn't taking this because in his younger body at the time, he was 7. I was what, 45? I'm like, this is intense. And I think that helped me be a no, no, no. I was always a no, but then there were moments where I'm like, maybe should we try, 6 months you try something and some alternative thing and it doesn't work. And you're like, should we maybe do medication for a while? But that sealed the deal. I was like, no, I'm not doing this. So I thought, man, this should be mandatory because you're giving this to your child that has no say, right? Because an adult can say yes or no, but a child that's under your care until they're an adult has no say. So you should at least, I think, experience what you're doing to a child, right?
Yeah. And I feel way differently when it comes to adults because my philosophy on substances and drugs, whether they're prescribed or not prescribed, is that adults in the United States, for the most part, can make their own decisions.
Yep.
So, to me, and again, I'm not going to sit here and say that stimulants have no role, but putting kids who don't have the ability to say no on these drugs at such a young age, not giving their brain time to develop and
Yeah.
accepting them for who they are at a young age
Yeah.
and allowing them to be part of that decision of whether to treat. And I swear, if I hear this one more time, I might just lose my sanity in total. But people saying, "Oh, well, no, you don't understand. See, my kid's the one that they're so impulsive, they just run into traffic." It's there's no way there's this many kids running into traffic.
No.
I mean, but the
No.
number of times that I've heard that, and it makes me wonder, is that from a previous like Chad article,
And
or
yeah.
has it been, recycled over and over again in different articles that people are reading? It's insane. I want to mention something that is a little bit more nuanced within ADHD, and it goes back to that world chart of medications and who uses the most. One of the most important and under discussed factors of ADHD treatment is that not every stimulant is the same. The risks are different. So you may have noticed how much amphetamines we prescribe compared to the rest of the world. People don't realize amphetamines are illegal, even for medical professionals to prescribe most countries in the world.
Yeah.
And I think that some of the reasons for that are because there are significant risks that are way more pronounced with amphetamines than they are with methylphenidate. Amphetamines increase the concentration of some of these molecules by asinine amounts, whereas methylphenidates increase a little bit but tend to recycle what's in that site of action, what's called the synapse, the area between two neurons. And methylphenidates are used for patients who've had traumatic brain injuries and are in the ICU to try to help stimulate their brain to wake up. I mean, this is what the literature says. I don't fully buy this. I would say they're more neuroprotective than amphetamines. Some of the literature says methylphenidate is neuroprotective in general. Not sure I agree with that. But there's data out there when it comes to amphetamines versus methylphenidate. The risks of psychosis, the risks of converting an individual into a manic state, the risks of sudden cardiac death and rises in heart rate and blood pressure are significantly higher with amphetamines.
Yeah.
So, why are we prescribing so many amphetamines? If we're gonna over prescribe, we could at least over prescribe the things that are less harmful.
I don't have the answer. I'm not an expert in medications, but to me, the obvious one seems that the Adderalls of the world, right? They have this quicker rush and this feeling of euphoria you get that you don't get from, I remember not getting that from Ritalin. They both had their effects, but I remember thinking, oh, Adderall is sort of more of the pick me up, right? The other one's more the softer, behind the scenes kind of working. And so I think people have just gotten used to this, like, oh, try that one. Oh my God, you're going to feel it right away. That's just my theory, but
So there's data on amphetamines versus methylphenidates and even dosages. So you're three times more likely to develop psychosis or mania on amphetamines. And that risk jumps to almost six times higher if the dose is above 30 milligrams of dextroamphetamine, which is about 35 milligrams of Adderall. And the other glossed over factor that nobody likes to talk about in the Chad articles in the ADHD magazines
yeah,
is that amphetamines are what are used to develop the animal model of mania. They give them amphetamines in high doses over long periods of time, and the animals get manic.
yeah.
So, and those are just psychosis and mania. They also
Well,
have higher risks of blood pressure, heart rate, cardiomyopathy, sudden cardiac death. And yes, the absolute risk of sudden cardiac death is low. But if I tell you that your kid has a 50% higher chance, still very, way less than 1% risk of dying suddenly, that's a pretty significant. I mean, it's not for me to decide, is my point.
yeah,
It's for me to present the information and allow the individual to decide based on risks and benefits, the adult. And this is the reason
yeah.
why I don't work with kids because I could not do it. I would not have any patience.
Yeah, I hear you. It's interesting because you, as a psychiatrist, you have the studies and you have the numbers, and it's right there, right? I, as a sort of layman interviewer, if you will, parent, researcher, I always tell parents in a very simple way, I say, look, there is a high risk of addiction. I don't make this up. There are studies, but go to this website, the DEA, look at Schedule 2 drugs that are highly addictive, and look in what company that Adderall and Ritalin sit. And it's cocaine, meth, fentanyl, right there in the same category. So if you need any more proof, I mean, yes, you can go find it. But to me, that's always been the simplest. Like, it's right there. You make a decision. It's not about, is it not good? Does it not have benefits? It does. But the highly addictive part is a risk that you're going to take. And your child might be fine, but it's like Russian roulette with three bullets in the chamber instead of one, right? It's like it's 50-50. I mean, Your call, like you said. It's not for us to decide, it's for them, but they should be armed with that knowledge.
Yeah, and I treat a lot of ADHD. I really do, and that may sound odd after having this conversation, but my philosophy is that we're in this world of just crazy prescribing.
Yeah.
And if I don't treat the person in front of me and meet them where they're at and try to educate them, then they'll go somewhere else and they'll get poorer treatment without the information, without the time dedicated to them. And if they understand the risks, and I'm very upfront with people, like I don't like prescribing Adderall and amphetamines. If you tell me that that has a favorable benefit to risk ratio for you, I may not believe you, but usually I'll meet you where you're at as long as you understand what those risks are. I think it's really unethical to, especially like these telehealth companies that pop up and during COVID, and they
Yeah.
just massively inflated the number of ADHD prescriptions that were out there. And people who were doing that, a lot of them had no idea
Yeah.
what risks they were actually putting people under.
And actually, I'm guilty of that because I got diagnosed by one called Ahead. That's how I got my meds delivered to the door the next day. Literally, I think it was maybe not, maybe 48 hours, right? And I remember this young evaluator telling me, and I filmed it. And I remember asking her, I said, I'm a little bit skeptical of medication because I've heard bad things and side effects. What are the side effects? And here's what she said, literally word by word. She said, well, don't worry about it. Back in the days, the Kennedys took it. So it's totally safe. I was like, oh, really? Okay. I played along. But to your point, right? It's like, I think if we had you as a psychiatrist back in the day with our son, I know you don't do kids, but if we had had you at that time, I think we would still have gone down exactly the route we are on now, because you're somebody who informs, who cautions, who is real, who has the studies, but also has the logic. And I think that's what parents need. You need somebody who is like, look, the struggle is real. Here's the symptoms. This is technically what your son's dealing with or your daughter. Medication's usually pitched as the first resort. I'm not going to start there. It's valuable. Let's figure out, let's dig deeper. Let's do therapy. Let's do all these things. And then if you want to medicate, of course, we can do that. That's what we need. And I think that's the minority of, yeah, I'm guessing here, but the minority of psychiatrists and psychologists out there, because looking at that graph that you showed me, there must be many that are overdiagnosing and over medicating.
Well, and I'll get labeled as, anti-scientific, that I'm not
Yeah.
following the actual science, that I'm cherry picking my studies. No, what I'm doing is I'm presenting the other side of this argument. I am not going to sit here and put up these, past studies on the risk of addiction. And I understand that may be a risk, but I also understand how the history of pharmaceutical companies getting embedded in the studies that they are in charge of and the tricks that they pull to convince, statistical significance when there's no clinical significance. The just absolute litany of legal suits against
Yeah.
certain makers and certain FDA approvals. Like this is just the same story playing out over and over and over again.
Yeah. You were talking about the not cherry picking the studies, right? Like you're somebody who's on the outside questioning, but you get labeled, because I can relate to that. Like I get a lot of that. Like if anything, my book is very controversial. Even here in town, I have a book signing coming up on October 5th, and it's at this really cool coffee shop. Living in a small town is definitely a bigger exposure, right? I pretty much am known here in town for the ADHD questioner, the guy who thinks ADHD is not real. I talked about this earlier. It's nuanced. The struggles are real. I believe the label's not. We created it. But so this book signing is coming up, and to sit outside of a bookstore with a book that says ADHD is over, I'm going to get a lot of heat, because normally there's somebody with a novel or with some poetry book or, some entertainment, but I'm going to be sitting there with a book that says ADHD is over. I'm going to get some looks, and I'm going to get people to come up and go, like, what is, it's the attitude of like, what is this? What are you talking about? Right. Which is fine with me, but I think it takes people like you and I to, and I always say the mainstream narrative is incomplete and one sided. and we're just filling in what's missing. And that's it. We're not saying that there isn't truth on that side. There is a lot of truth. Some of it is manipulated by financial interests and, like you said, cherry picked. But there's a lot of truth. At the same time, all we're saying is please give this other side as much of weight or value, right? And we're presenting that. So hopefully parents will read my book or, listen to your podcast or my podcast and be like, huh, interesting. Let me make a note of that. That's all we're really asking, right?
Yeah, absolutely. And again, I want to go back to the idea that, there are multiple things that can be true in this conversation. There can be a neurobiological consistency with brain connectivity that leads to symptoms of ADHD. That can exist, just like there can be brain differences that lead to, what we're starting to call neurodivergent autism, not Asperger's, not low functioning or, some degree of functioning autism, but, oh, this is a person who is not intellectually disabled in any way, but their brain obviously works different. That doesn't need to be treated away. We don't all need to be a homogenous population of people who all think the same and follow the same guidelines or theories or ideas. So both of those can be true.
Yeah.
ADHD can exist, and we can not treat it as much as we are now, medication wise. We can work to better understand it and recognize and try to guide those individuals into fields that they may excel, into areas of life that they may excel, as
Yeah.
opposed to, you're broken, we need to fix you.
There was a study done by somebody I interviewed a long time ago amongst entrepreneurs, and I think it's like 85% of them could be considered as ADHD. Why? Because they want to do their own thing. They don't want to sit still in an office and file paperwork. They started their own company. They need excitement. They want to do different things. It makes sense. But if you force your child down the Ivy League track and down into some lawyer track or doctor track, nothing against doctors, obviously, but like if that's not what the child wants to do, there's going to be friction. There's going to be like, wow, he doesn't want to study. He's lazy. He doesn't want to do it. It's like, yeah, it's a matter of misalignment. It's not that they can't. They can focus on something that they're passionate about. What are their passions? Can we support them in that? Can we help them get into a field that actually is beneficial for the way their brain functions, right? The way they operate.
Yeah, most people can stay attentive and focused when they really care about what they're doing. If you have a bowling ball that is traveling through the air in your direction, you're going to be able to stay attentive and focused on that bowling ball. You're not
Yeah.
going to suddenly get your ADHD and let the
Yeah.
bowling ball hit you in the face.
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.
Or, put more simply,
if you need help like this guy, call your own doctor.
thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.